Hi guys, it's Robin again. Alright, so leukocytes are made up of neutrophils, eosinophils, basophils, lymphocytes, and monocytes. So here we go. This is kind of a silly picture, but this is Nancy neutrophil. And as you can see, here are some of her defining characteristics. Her nucleus has anywhere from 2 to 5 lobes. She is about 10 to 12 micrometers in size, light lilac color. She is, I put on here EMT because the neutrophils are basically the first responders to injury sites. The absolute percentage of neutrophils in the blood is about 50 to 70%, which articulates to about somewhere around 4,500. If there is an increase in neutrophils, then it indicates infection or inflammation. And if there's a decrease, it indicates that there's drug toxicity, or it also indicates that the body is more susceptible to getting infected. Alright? Then we have eosinophil. The nucleus has about 2 lobes, red to orange in color. So what the eosinophil does is it collects histamines from the body. It is also parasitic, or it is also toxic to parasitic worms, which, that's why it's angry. But it's also capable of phagocytosis. Now these eosinophils make up only 2 to 4% of leukocytes in the blood. This articulates to about 165 eosinophils in the blood. If there is an increase of eosinophils in the blood, then it indicates allergies, a possible parasitic worm infection, autoimmune disorders. If there's a decrease, once again, drug toxicity, and it indicates stress. Next, we've got Bruce Basophil. He is 8 to 10 micrometers in size, kind of a bluish purplish appearance, and the nucleus has 1 to 2 lobes. The function of the basophil is to increase intensity of the inflammatory response. So these cells are the ones that, what do I want to say? They're the ones who attract a bunch of attention to the fact that there is an injury and then get the neutrophils involved. They also release histamines and heparin. They are less than 1% of the leukocytes in the blood, which is about 44. So if there's an increase in basophils, it indicates allergies, parasitic infections, and hypothyroidism. If there's a decrease, then it indicates possible pregnancy, stress, of course, and hyperthyroidism. Alright, the next one's kind of silly. I used a meme and I made it my own for the purpose of this video. This is about the lymphocytes. The lymphocytes are small. They are about, they can come small, but they can also come in a larger size. So the small ones are about 6 to 9 micrometers, and the large ones are 10 to 14 micrometers. Now, here we have the meme. And so the natural killer lymphocytes, they provide general immunity to the body. The B lymphocytes and the T lymphocytes create pathogen defense, while the B cell produces antibodies and the T cell physically attacks. The lymphocytes make up about 20 to 30% of the leukocytes, so about 2,000 per microliter. If there's an increase in lymphocytes, then it indicates viral infections and can also indicate the presence of cancer. And if there's a decrease in lymphocytes, then it can indicate chronic disease.